The current strain is quite serious. The strain that you've heard more about is called the Zaire strain, and that is what we consider the most serious. The current strain is called the Bundibugyo strain, and it's pretty rare. This is only the third outbreak it's ever caused. So it's quite serious in that we estimate it has about a 50% case fatality rate if untreated. I'm Dr. Nita Bharti. I'm an associate professor of biology at Penn State University and a member of the faculty of the Center for Infectious Disease Dynamics. The Ebola virus is actually a group of viruses. It is a genus of viruses with a number of species in it. And so there's about 5-ish viruses, we'll say. And 3 of them cause most of the human disease that you've heard about. One of those is currently transmitting and causing an outbreak in the Democratic Republic of Congo and Uganda. Essentially what's being done is really solid boots on the ground epidemiology, so contact tracing, case management, isolation and quarantine. There are efforts to determine the cross immunity between the Zaire strain and the Bundibugyo strain, so determining how effective the vaccine we have might be during this outbreak, and really trying to contain the outbreak from spreading further. One of the biggest problems with this outbreak is that it's taken a while to determine what it was causing these illnesses and deaths. And that means that we're behind what would be an exponential curve of transmission. So that's why the outbreak was so large when it was first announced. The scale of the outbreak is really hard to know right now. What we know is that there are hundreds of cases and a little bit under 100 deaths right now. The true numbers are probably much larger. And the reason we think that is because with Ebola, and I'll come back to this in a minute, but with Ebola, the origin of the outbreak is usually a point source, which means you start with kind of one case or one kind of cluster of cases. And what we're seeing right now is that we have cases and deaths that are likely part of this outbreak that are not connected, that are not contacts. And so we have multiple branches of transmission that are not connected and that are now definitely part of this outbreak. And so that means that we've missed kind of a lot of transmission. The scale of the outbreak is probably much larger than we currently realize. So Ebola is transmitted from a person who is infected and symptomatic to a person who is susceptible via bodily fluids. So it could be anything from blood or vomit, things like that. And it really is close contact. So this is often a virus that is transmitted to caregivers, so medical personnel or family members, household members, and it's not a casual contact transmission. Really, you're only at risk if you've come into close contact with somebody who is infected and symptomatic. You are not at risk even if you've just been in passing contact with somebody who was infected and symptomatic with Ebola. There really aren't cases outside of the immediately affected area in Central Africa right now. And again, that's northeast DRC and kind of the border of Uganda. Other areas of the world really aren't at risk and people don't need to worry. Within that area, it is certainly a cause for concern. Obviously, this is a big deal because public health is global health. We're all connected, and one of the things that we know very well is that mobility and movement across the planet happens very rapidly and very easily, so diseases can spread, but beyond that, we are all really connected, right? So negative health impacts in one part of the world really do affect us all, whether or not we get infected. Do we look adequate? All right, I'll get out of the way. They used the vaccine in response. And so we were